Hello, everyone. I'm Dr. Leyanna Susan George, working as a scientist at the Indian Council of Medical Research. I'm very happy to be a part of the 2024 India Leadership Journey. And the title of my project is Facilitators and Barriers Faced by Women Practicing Public Health in India. As you all know, public health professionals work to improve the safety of communities through education, research, policy, and prevention. Whether on the front lines or working behind the scenes, women in public health have moved our country and the world forwards. In India, women have to juggle between their commitments towards their families and communities while working professionally as well. And for the past 15 years, I have been doing the same. Hence, that prompted me to take up this project. The primary objective of this study being facilitators and barriers faced by women practicing public health in India, and the secondary are to look at the initiatives that these women would like to put in place to improve the workspace for women, also to identify the support systems that they would like to have for future women coming into the public health field, and also to identify women specific health research topics that they would like to work on. With these objectives in mind, a qualitative research was conducted among the women public health specialists who are working as scientists across different cadres at the ICMR headquarters, and 25 such in depth interviews were conducted after relevant permissions were obtained. It was recorded and it was analyzed thematically. Now, coming to the findings, there were three major facilitators that were identified. The first and foremost being the supportive family, the presence of good mentors. And the third was a quite interesting finding where one of the medical scientists stated that public health field itself was a soft area of work, which was a facilitator when compared to a clinical area which was more hectic and women were finding it difficult to work there. So public health field itself was a facilitator. Now coming to the barriers, there was a division of opinion here where one half of them stated that gender did play a major role as a barrier. They felt that women put all the diligent hard work, but often the men became the face of the work or the organization. Some of them felt that they were not even considered for certain tasks because they had a young family. And one participant even went on to state that there were very subtle signs in the society that there were these invisible hands that guided them to take up certain career paths. While the rest half of them clearly stated that gender was not a barrier. And if they had to skip assignments or not take up a particular challenge, it was a decision that they made based on their own priorities in life and not because they had to fulfill a gender role. When asked if there was a difference in the opportunities for males and females, it was interesting to know that all the women scientists stated that it was more favorable for women because nowadays India's policies are more women centric, encouraging women to come forward. And they often want women to be recruited for a particular position or they wanted a female representative in a committee. Most of them felt very bad about this and they felt that this was not a good thing for women development. They wanted to be there because of their merit and not to just fill up a quota. When asked whether the gender of the boss made a difference, most of them were the opinion that the gender did not make much of a difference, but it's only the person that made the difference. But however, there were certain advantages of having a female boss than having a male boss, because some of them felt that men often meet after office hours and there was a male bonding that happened and networking that happened for which women were not usually invited for. So it wasn't an equal playground for males and females. They also went on to state that there is a huge women workforce in the public health sphere of women, but however, the leadership positions were not being provided for these women. When asked about the exact workspace improvements that they want to bring about for the women, all of them stated that they want a separate area to rest, they wanted a creche, they wanted flexible hours for women, menstrual leaves, availability of sanitary napkins and clean toilets, or some of the workspace improvements that they would, as leaders, put forward for improving the quality of life of women at workspaces. And when asked what support system they would like to put forward for future women public health specialists, they said that they would build their confidence, provide opportunities, and support them, especially after they return back from their maternity leave. They felt they need to motivate them and also provide opportunities to enhance their capacity building. And when asked to list out the future work that they would like to do in the area of women's health, All of them agreed 100% that the woman's mental health is often neglected, and women are usually stressed out due to the double role that they play. Physical health, especially self care and fitness, is an area that needs to be worked on. Menstrual health, even though work is happening, much more needs to be done. And there should also be a need to identify what women usually need because they are often not asked. Research also needs to be done on women empowerment measures, access to healthcare services for women where interventions reach out to women rather than vice versa. They also suggested that sensitization of women's health need is also required, especially for men. So that brings me to the limitations of the study. Definitely, this is a context specific and cannot be attributed to a wider audience. It consists of perspectives of accomplished women working in one particular research organization that mainly focuses on public health research. However, the outcomes and the way forward in the study is quite interesting. I was amazed by the sense of sisterhood that existed. There are these group of empowered women who actually felt the dedicated need to create supportive work environment for women. They also felt that there is a need for networking among women public health specialists beyond office hours, beyond just small talk, and need to really network for improving their careers. So I think that is from where we need to, or where I need to work forward, and that's the way forward for me. So that's all from my end. Thank you for your time.